Okay guys, I'm going to try to cover this really quickly. This is congenital heart diseases. Now the thing about congenital heart diseases, you'll see it in children and they will usually either they can be cyanotic and the children will be blue and they'll be dyspneic and they'll have a lot of issues. Then you'll do an echo and you'll be like, whoa, this is crazy, and you'll see this entire absurd presentation on the echo. And then you have to understand that most of these are cardiothoracic surgery. Okay, so you have to go to cardiothoracic and vascular surgeon CTVS, and they have to operate and realign the tubes. Now a normal heart has 4 chambers. That's the right atria, right ventricle, left atria, left ventricle, and then while it develops in between the two chambers, there is a foramen ovale because of the fetal circulation, which is different. Now, what happens in case of in tetralogy of Fallot is that there is a severe pulmonary stenosis. It is not a tricuspid stenosis, but it's a pulmonary stenosis. And this severe pulmonary stenosis, what it does is it makes his right ventricle work very hard. And when this right ventricle starts working very hard, there is hypertrophy of this right ventricle, which then pushes the aorta and causes overriding of the aorta. And then the pressure builds up so much that it bursts open the septum and causes a VST. So that is the components of this tetralogy of Fallot, all those components, which is pulmonary stenosis, right ventricular hypertrophy, overriding of aorta, and VST. Now, this you will have various murmurs, like you can hear a VSD murmur or a pulmonary stenosis kind of murmur, and tetralogy of Fallot can be associated with Down syndrome. So this is one of the congenital heart anomalies. There are like 5, basically all 5 are they start with T. An easy way to remember is one vessel is truncus arteriosus, and then transposition of the great vessels, tricuspid atresia, tetralogy of Fallot, and total anomalous pulmonary venous return. So you have all these 5 as the congenital heart uh, diseases, and all of them usually present with cyanosis. Now, in truncus arteriosus, you have just one vessel, so your pulmonary outflow and your cardiac outflow are one, and then you need the CTVS surgeon to come and make 2 separate tracks. Transposition of great vessels is again where you have the 2 great vessels are the aorta and the pulmonary trunk. The aorta leaves from the left ventricle normally, and the pulmonary trunk leaves from the right ventricle normally. And what happens is they get switched. So blood from the aorta goes into the pulmonary trunk, and then blood from the right ventricle goes into the aorta. And then these people, they are alive only because of the patent ductus arteriosus, PDA, and then that patent ductus arteriosus keeps these transposition kids alive. So what happens is that we need the CTVS surgeon to come reverse this and make those tubes correct. So that's transposition of the great vessels. And then tricuspid atresia is absence of tricuspid valve and hypoplastic right ventricle. So basically this tricuspid valve is not there, and then the right ventricle becomes very tiny. So you have a very large atrium. This is very similar to what you see in Epstein's anomaly. Here in Epstein's anomaly, what happens is if the mother takes lithium during pregnancy, then there can be Epstein's anomaly, which causes atrialization of the ventricle, and that is very similar to tricuspid atresia. So they can be interlinked with each other. And then total anomalous pulmonary venous return is pulmonary veins. Normally, they are the atrial fibrillation and stuff starts around the return points of pulmonary veins. These pulmonary veins are what returns blood to the right to the left atrium, and then from left atrium it goes to left ventricle. So if these pulmonary veins drain into right circulation, then there's again havoc and you need to repair it. So these are the cyanotic heart diseases. Now what happens very commonly is that in the atrial septal formation and the ventricular septal formation, if there is any abnormality, you can have an ASD or a VSD. Now an ASD has fixed wide splitting, which is uh, uh, fixed wide splitting of the second heart sound, which is normally A to P2, second heart sound has two components. One is the aortic component and the pulmonary component when you hear it, and there will be a fixed wide splitting because of this pressure, and always the pressure is higher on the left side. So you will have blood flowing from this side, from the left heart to the right heart, and then there will be fixed wide splitting of the heart sound in atrial septal defect. VSD, again, you can have a continuous murmur, machine-like murmur, which has to just be repaired with a patch, or ASD has to be repaired with a patch and closed. So patent ductus arteriosus we already discussed in the case of a patent ductus arteriosus being a requirement for the survival of transposition of the great vessels. And you can have patent ductus arteriosus which causes abnormal blood flow to two arms, which is where you have a pulse difference in your right and left arm. And you can have that also seen in coarctation of the aorta. You can have three types of coarctation of the aorta. You can have it at three different points of the aorta, and depending on which point it is, you can have varied presentations of this coarctation of the aorta. And you can have abnormal pulses to one side in coarctation of the aorta. So basically there's a syndrome called Eisenmenger syndrome where you have the right heart and the left heart which are working in synchrony. So normally when there is shunting of blood from the left to right side, from left side it's usually oxygenated blood, and so then there should not be cyanosis because it's oxygenated blood, but extra blood is going towards the towards the lungs. But if the shunt pressure, like initially blood flow keeps coming from the left heart to the right heart, and then this right heart is made to work overtime and work very hard. So what happens is this right heart hypertrophies significantly, and it causes reversal of blood flow from the right back to the left. So then this phenomena is called Eisenmengerization, where the blood from the right side starts going to the left side because of the pressure overload. Over time, this becomes hypertrophied, and then it causes cyanosis. So delayed cyanosis is called Eisenmengerization or Eisenmenger syndrome. And then you have these congenital cardiac defect associations, where like if the mother takes a lot of alcohol, the baby may have a VSD, PDA, ASD, or go into tetralogy of Fallot. If the mother has rubella during pregnancy, PDA is known to be there, pulmonary artery stenosis or septal defects. If the mother or if the baby has Down syndrome per se, Down syndrome is very commonly associated with ASD and VSD. If the patient has Marfan syndrome, connective tissue disorder, then there is a mitral valve prolapse, aortic aneurysm, and dissection. And if the patient has lithium, it's Epstein's anomaly or tricuspid atresia. And in Turner syndrome, we have bicuspid aortic valve and coarctation of the aorta like presentation. Williams syndrome, you have supravalvular aortic stenosis. And in 22q11, you have tetralogy of Fallot. So these are the this is a rapid review of congenital heart diseases.